Hello, future nurses. This is Professor Hale. I will be covering nasopharyngitis in this video specifically, and this is depicted from your Chapter 30 in your maternity and pediatric nursing care. Introduction. Usually preschool and grade school children are most frequently affected by this infection. It's mostly considered as a common cold. It's more frequent in winters. Symptoms usually improve between like 4 to 5 days and usually are gone by 10 days to 2 weeks. The spread is usually from one person to another by droplet method or direct contact. Symptoms include fever. So fever is common, especially in young children. Older children have low-grade fevers, which appear early and suddenly. Dyspnea, which is onset of dyspnea, is abrupt, sometimes preceded by a cough or a nasal discharge. And then there's cough. Symptoms include a dry or persistent cough with nasopharyngitis. Nasal inflammation or congestion. Nasal inflammation may lead to obstruction of passages, and continually wiping away of secretions causes skin irritation to the nares. So just think of when you have a cold, how much it compromises your skin tissue. Symptoms usually improve after 4 to 5 days and are gone by 10 days to 2 weeks. Usually diagnostic evaluation is obtaining a good history on the pediatric child or patient. Physical examination of the eyes, ears, throat, and chest. So that means, just want to look at the eyes. Are they red, or there's a lot of drainage? Is there airs in the ears? Are there symptoms of otitis media, ear infection? The throat, is it red, inflamed? Presentation of bacteria is present. And then the chest, how are the respirations, the quality of their breaths, what are their lung sounds, what is their oxygenation. Diagnostic tests include throat culture, which is a standard diagnosis. Results can take up to usually 48 hours, and this is like a culture. So that's with any culture. So it's just to allow the organisms to grow and determine what's causing the illness, if it's bacteria. Rapid testing. So this is in conjunction with the throat culture. It's like a rapid strep test. So they want to determine if it's a strep related or if it's turned into a strep or infection. Then any test for any viral cause. They'll get a lab work done, which is a CBC, white blood count, and also get a monospot test. Medical and pharmacological management. Medical is oxygenation administration. So if you see, a child into respiratory distress, you're going to want to ensure that they maintain that open patent airway. So that is priority. Oral or IV fluids, and it's the signs and symptoms of dehydration present in a child. Medications include like possible antibiotics, antipyretics for fever, corticosteroids to reduce any inflammation. Nursing care includes you want to instruct guardians or parents about home management and medications. So with any medications, this is pretty much, you see the trend. Any medication, you want to know, the side effects to be expected, adverse reactions, and or allergy reactions or adverse reactions. Those are things you want to make note. What laboratory values are you going to look for? And also medications, especially in pediatrics, is all weight-based. So you want to get an accurate weight, and this is by scale. Antipyretics for fevers, you want to treat them. Encourage rest. You want to provide vaporized air, which is like a cool mist. If you don't have like a cool mist or vaporizer, you can actually put them outside in the cool air. Give decongestants for children older than 6 years. Give cough suppressants, and you want to use with caution because you don't want to over-sedate your child with. They don't want to over-sedate the child. Antihistamines usually are not recommended for children, and antibiotics are not indicated for viral infections. However, this is why they get the throat culture and rapid strep to ensure to see if determine if there's any bacteria involvement. If there is a bacterial infection, obviously there will be an antibiotic treatment. And when that occurs, if that is necessary, then you would want to evaluate if there's any allergies. And symptomatic treatment, you want to manage the symptoms, the coughing, the fever, the pain, the headaches. So those for antipyretics. You want to make sure you want to maintain the fever by giving either acetaminophen or ibuprofen, but you do not want to give any aspirin. Prevention is with any viral is just standard. Hand washing, covering the mouth and nose while they're coughing and sneezing. Usually, if they can just go into the elbow, the sleeve of their elbow, the crevice of their elbow, and just go sneeze or cough in there rather than their hands. Education on antibiotic treatment. If it's bacterial, you want to, stress to the guardians that full treatment is necessary and that they complete that, and that the right dose is given according to the age and weight. Antibiotics are usually not indicated for viral infections. Child may return to 24 hours after the last fever, and the child has a minimum of 24 hours of the antibiotics before they return to school. And that's pretty much it for nasopharyngitis.